The topic is identifying clients who need assistance in a mental health professional in addition to you, and what to do to identify them, and then what to do when you are concerned. So that was a long list of possible ways to identify them. And then you say, well, gee, I'm working with somebody and I'm concerned. And then what? Well, I think the very first thing is to talk to somebody that knows more than you do. And no matter how experienced, I think it's important. 6 months ago, I called Rick Ingrassi. And I said, Rick, you're a psychiatrist, you're an MD, I've got a client, and I'm afraid she's suicidal. I mean, she's talking about suicide. And he interviewed me and said, well, what in particular, and what are you doing, and is this person under the care of a doctor? And we talked. And then I called Stan. And Stan's a licensed professional counselor, and I had the same conversation. And then I don't need to tell the rest of the story. It turns out good, but I certainly want to get assistance when those characteristics that are outlined in those handouts that you read occur. So my message here is check into yourself periodically by those lists, and then get assistance from people that know more than you do, and then refer. Like in this case, I made sure that she was seeing a psychiatrist, and she was on medication. And I insisted that she go back and check with the doctor again, and she did. I didn't stop coaching her because I actually felt like my coaching was very useful, even in the subject of suicide. But I didn't want to be alone in that partnership. I wanted to make certain that that she had somebody that knew a lot more than I did about that topic. So want to hear from you. What are your questions about this? What are your concerns? What are your ideas? I'm open to hearing, of course, from the staff, as always, your ideas. What have we got?
I'm wondering if you have any advice for working with a client who does have a mental health issue, is getting all of the support she needs in that regard in terms of working with therapists and doctors and medication, etc. But just being in that coaching relationship with them when they are dealing with that. Because I worked with a client for 6 months or so, and it was a really big challenge with the coaching, and it ended up it ended, and I didn't really feel like I served her as well as I wanted to.
Yeah. Well, in this case, Rachel, I actually think that what I did turned her life around. I mean, she turned her life around, of course, but following my recommendation, which was to keep track every 2 or 3 hours of her mood, on a scale of -10, which was suicidal, like I'm clear, I want to end it all, to +10, which is ecstatic. And she came up with the words to label every one of the numbers, and then sent me her mood scores every time we spoke. And we spoke twice a week, and we reviewed the mood scores. And I assisted her to not blame her mood on the circumstances, because what she was doing was hooking her mood to the circumstance. For example, I don't have a job. Well, that's why I'm so, or, my kids are upset. That's why I'm so depressed. Or, I've got money problems, or whatever it was. And to break that connection. Yes, you have money problems, and you've had money problems and been in a good mood. Some days you're in a good mood with money problems. Some days you're in a bad mood with money problems. Money problems don't cause your mood.
I guess what I realized as you were answering is my question was, in this particular case, she was working with her mental health professionals on that issue, and she was coming to me for career visioning stuff. So I wasn't able to really affect any change on the problem. So I don't, maybe it's an unanswerable question, but.
Well, I think that what you're bringing to mind is that some people that we coach don't want whole life coaching. And that's all right. They just want to be coached in one particular area, and then that's probably the only place we're going to have much effect, because that's what they want.
So basically, I should just let this go. That,
Yeah.
you know, she wasn't in a place to receive that coaching because of this other issue, and
Yeah, yeah. And she wasn't, and she didn't want to deal with the other issue with you.
yeah.
Yeah. Good.
Well, and I think this is another good example of that. We can't always see how big a difference we're going to make in a small amount of time, and when we remember that, I think then we remember that we can come light and happy, and just somewhere in the back of our mind know that that could have a useful effect for somebody like that, or we might find an opportunity where it works for the client to talk about assumptions, like, no kidding, you really don't see much that is out there that you're excited about? Wow, no kidding. You know, so you can have those dialogues when they make sense. But at the very least, you can bring being so dang excited about life that it gets catchy.
I have a question about this kind of interchange. I have a client who told me in a session that he had had fleeting thoughts of suicide. And like Joanne, I just stopped being a coach right then and said to him, I would insist that you find a counselor because I'm in no way prepared to treat the thing that you have brought up. So we are still in a coaching relationship, of course, and he has told me that he has found a counselor. Now, my question is this: how far do you go to assure that that has actually happened? I do trust him. I believe that he has, but I have no real knowledge about who the counselor is or whether or not how often he's seeing him and so on. So I just have that as a question. How far do you go to assure that that is true?
Yeah, it's a good question, Margaret. I tend to just always believe my client, but I want to hear from Rick about this because he's got an opinion and I trust his more than mine.
Well, this is a tricky area because, for instance, a lot of psychiatrists are what are called biological psychiatrists. They're trained to deliver medication. They do brief psychotherapy, cognitive therapy, etc. Nothing wrong with that, but when it comes to an appreciation of coaching or this other frame of reference, what I would suggest is try, if you're going to refer somebody, or try to identify experts who actually understand or know what you're doing, so that they have some context for helping the person to use the coaching and to use the counseling together. I used to work in the realm of what was called spiritual emergencies back in the 70s and 80s, where people would be having Kundalini experiences or kind of radical out-of-body states, etc. And they would end up in the emergency room and be treated as if they had a heart attack, because sometimes it was a block in the fourth chakra, etc. Some of you may not be familiar with that frame of reference, but that's exactly my point, that if you're not familiar with what a spiritual emergency might look like, you don't diagnose it, you don't see it, you actually treat it as a physical symptom or something like that. So my only suggestion is don't be afraid to ask your client, well, how's it going in the counseling? What are you focusing on? You don't have to get too in depth with the content, but just get some sense that there's a process that's somehow related to what you're doing, and that should reassure both you and the client to know that you're on the same page.
Rick, just part of my question, I mean, I have this standing principle to believe my client.
Yeah.
But I think what Margaret's asking is, what if she doubted? Or what if I even had some intuition and I said to my client, well, did you go to the doctor to get your blood pressure checked? And he finally said, yeah, I did. Yeah, I did. I'm under the care of a doctor. And I'm thinking, do I ever, well, I guess I can't call the doctor. I can't call the counselor. Unless, I guess I could ask the client, if I really doubted, I could say, well, I'd like your permission to talk to the counselor briefly about it. So if I was really in doubt, I could say to the client, I want your permission to talk to the doctor.
Yeah, and what I do in that situation, for instance, if somebody's going to a therapist or a counselor, I ask, what's the person's name? Does the person know that you're doing life coaching?
Yeah.
How do they feel about that? Most therapists are okay with it. They don't see it as a conflict, but it's not a simple thing. I always try to trust my gut. If you ask a person a few questions and they're clearly trying to mask the truth, then you have to decide how much do I want to push. I don't think there's a simple answer to that, but trust your gut.
I do want to underline what Rick said, which is that if you're coaching someone who's also seeing a psychiatrist or a counselor, tell them that you really want the counselor or the psychiatrist to know that you're in the picture too. I think that's a good step.
This is a subject that's very near and dear to me. I'm coaching a woman who has dissociative identity disorder, who formerly known as multiple personality disorder, and she has her primary therapist, and she's doing her trauma work with him. And she comes to me, and what we've defined it as life skills. The point I want to make is that just because someone has a diagnosable mental disorder does not at all mean they're not great candidates for coaching, because these two are going so well hand in hand. I've never met the guy, but he knows what I'm doing. I know what he's doing. And she is doing the trauma work with him. And what we do as coaches is we help people learn life skills. At least that's one of the ways to look at it. And these life skills are so helpful to her in her work with the trauma. Totally different. The other guy's not doing that. And so I'm just saying it's really a nice blend and a nice distinction between psychotherapy and coaching, and they go really well together. So don't be afraid to coach somebody just because they have a diagnosable mental disorder.
This is just kind of common sense logic, but going back to Margaret's, I've been coaching a woman for over a year who was going through some very serious marital problems and started marriage counseling. And so I didn't think of it as sneaky, but I just said, let's take 5 minutes and define the boundaries. I mean, you don't want to spend money talking to me about what you should be talking with your marriage counselor about, so why don't you tell me what you're talking about? Just take 5 minutes, and there we'll only have appropriate overlap, and you'll at any time say, Joe, you're going into this part that I'm covering on Wednesday. And it just verified with me because she gave enough specific examples. I knew she was in counseling.
Good job, Joe.